Okay, so good morning, everyone. My name is Alex Murray. I'm an undergraduate in the Health and Community Service program with a focus in Indigenous health. And before I begin, I'd like to thank Michael for acknowledging the traditional territory that we're on. So the purpose of my presentation is to illuminate the case that I derived from my Practicum Placement, which is the importance of nonverbal communication with individuals at risk of or experiencing homelessness. Oops.
Yeah,
all right.
You can start again. We'll give you the time.
Thanks. Okay, so my Practicum Placement was under the mentorship of Christy Rebenchuk, the main outreach coordinator with the Community Homeless Assistance Team, or CHAT, which is located in downtown Winnipeg, Manitoba, Treaty 1 territory, or the traditional land of the Anishinaabe people, or the homeland of the Métis Nation. To touch briefly on what CHAT does exactly, as stated on the CHAT website, it is dedicated to performing comprehensive outreach for individuals at risk of or experiencing homelessness. Some of the duties I fulfilled while doing my placement with CHAT included frontline outreach, advocacy, health and community service systems navigation, service referral, and the construction of a magazine that showcased the work that CHAT conducts. All of my duties involved communicating with clients, often on the street and rarely in an office. So this meant I really had to refine my communication skills, but what I didn't realize is that I needed to refine my nonverbal communication skills as well. So over the course of my practicum, I concluded that there were three central ways to communicate nonverbally: through body language, facial expression, and eye contact, and clothing. So first of all, body language. This can affect the entire mood of a conversation, which can impact the perceived attentiveness of a listener, which also dictates the listener's level of involvement in a conversation. Although each situation is unique and there is not one generalized approach to body language, it is important to remain professional and to provide clients with a safe and trusting environment in which to communicate. While conducting outreach work at CHAT, staff and volunteers adapt a posture that doesn't look authoritative or aggressive, so we try and avoid looking like a cop or anything. No hands at our hips, no crossing the arms. We'd even try and avoid putting our hands in our pockets. Second, facial expression and eye contact. Through these, an individual can really interpret the reception of the information that they are conveying. In certain circumstances, individuals may be speaking about past or present traumas that they may be experiencing. The retelling of these events can be very painful and often conjure blocked or forgotten memories. So, attentiveness, active listening, and retention are incredibly important. Here's a few examples of how to actively listen. When we think about eye contact through westernized norms, it's often a sign of respect and attention, but when we can think about Indigenous perspectives, in some circumstances it's considered rude or threatening to look someone directly in the eye. In some scenarios, avoiding eye contact is done out of respect. In other scenarios, it's avoided because the eyes are considered the window to the soul. And if you look directly into someone's eyes, it's an interpretation that you're trying to steal that person's soul. I came in contact with an Indigenous male who would not speak to me or any other CHAT employee if we were looking him directly in the eye. So we'd respectively avoid eye contact when we communicate with him. Clothing is important to consider because people often connect expensive clothing to wealth. So it's important for outreach workers to maybe wear gently worn or secondhand clothing. This can help decrease the divide between a service provider and a client. At CHAT, we typically dress in all black, and the reason for this is because we wanted to avoid possible associations with gangs. The top left is Manitoba Warriors gang graffiti. On the right, that's Native Syndicate art, and Manitoba Warriors wears red, Native Syndicate wears white. So we'd wear just straight black to avoid any associations because many CHAT clients were previously or are currently gang members. So thinking about nonverbal communication in general, it's important to provide the most comfortable environment possible for the population that we're serving. Through conscious consideration of our body language, eye contact, and facial expression and clothing, we can create a conversational space that is specific to the individual's needs. So through all of this, what worked? I found that integrating problem-solving skills and cultural safety skills aided in improvisational nonverbal communication when communicating with diverse cultural backgrounds. What didn't work: the critical appraisal of health information was difficult at times as a result of inconsistencies with information sharing between organizations. Because of health issues a client may possess, the lack of information affected nonverbal communication. And that's what I got for you today.
Thank you, Alex. That was awesome. And I bet everybody in this room was checking their posture, their gaze, the whole thing while you were listening. So, questions?
Thank you. That was really interesting. I'm curious, how did you find out about nonverbal communication? Did you read about it? Did you have a training about it, or trial and error?
There was no training that I received on it. I just kind of had to learn on the fly. When I got thrown into frontline outreach, it's not exactly what I was expecting. But luckily it was the winter time, and I just wore a lot of heavy clothes and was shrouded in hoods and toques, so a lot of people couldn't really see me or what I was doing, and I couldn't really see other people because they'd be wearing big jackets as well. But nice weather started to come out, and I'd wear clothes that weren't all black necessarily, and I had a few people completely ignore me and not even pay attention to me because the divide was just too great. And yeah, I received a trauma-informed care information session, and we just learned about the traumas that people go through and how they carry them, and it's considered an injury in a lot of scenarios. So with that in mind, I just tried to reflect on that, and if someone was telling me something very traumatic, I wouldn't try and display it on my face because they could interpret that really negatively, like their story's really horrific or something. So remaining calm was really important. Does that answer your question?
Yes.
Any other questions? All right, well with that, thank you, Alex.